One of the things that we found when we spoke to a lot of women, most of them aren't training for a triathlon, working to run a 4-minute mile. They're really living their life. They've got a job, they've got family, they've got other commitments, and they're trying to find a way where they can feel healthier, get better sleep, like the way they look, but do something that fits into their lifestyle because we're all busy.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by John Mastrototaro, CEO of Movano Health. In this episode, we talk about the future of non-invasive health monitoring. John shares the company's plans to launch Evie, a smart ring focused on women's health. Plus, we discuss the shift from wellness wearables to FDA-approved medical devices that could transform healthcare. Let's get into it. The Fitt Insider Podcast is brought to you by Jack Taylor, our exclusive PR partner. More than just PR, they're creative storytellers and brand builders who actually understand the health and wellness industry. To learn more, head to fit.co/JackTaylor. That's FITT.co/JackTaylor. Hi, John. Welcome to Fitt Insider. Thanks for joining us.
Thank you. My pleasure.
Yeah, I'm excited to chat today. Certainly a lot going on in the wearable space and health tracking more broadly, what you're working on at Movano and certainly with Evie, the health tracking ring. I think, at Fitt Insider, we've covered it to this point in the past, all these developments, some information, news around seeking FDA clearance, getting it introduced to the consumers. I think it sounds like this fall potentially. So yeah, for those who aren't familiar, why don't you give us maybe a quick intro about you, what you're working on, and yeah, we'll get into it from there.
Sure. Well, I'm a 30-year medical device veteran, so that's where I've spent most of my career. A lot of it was in the diabetes space. I actually led the development of the first continuous glucose monitoring system that was ever cleared by the FDA back in 1999. And we then tied that system to insulin pumps and had a bunch of firsts in the industry, really helping provide tools for people who are living with type 1 diabetes, where they need insulin to survive. And then later on in my career, I got very interested in digital health and wellness and how we could help people who are living with chronic conditions in their home as they live their daily life. Obviously, that started with type 1 diabetes work I did, but now looking at it more broadly, and even to the point today, where we're really looking at how can we help with prevention to help people so they don't get diabetes or they don't get high blood pressure longer term, and they can live a much longer and healthier life and more meaningful life. So this has been an exciting ride for myself to be in this space and be working on products that can be used in that capacity.
Yeah, I think there's a lot to get into on that front. And I think there's specific interest around, how do we take what is a medical device and make that kind of broadly accessible from a consumer perspective and what that looks like in terms of hopefully prevention, right? Like that's the goal at the end of the day. Before we do that, as it relates to Movano, what you're working on, how this is kind of played out. Can you give us kind of like the high level view, not only the company, but some of the hardware that you're working on introducing and what that kind of looks like in terms of the offerings and maybe how people might interact with the company?
Sure. So the company was founded by a person, Michael Liebman, who has a really in-depth RF background over 20 years and had the idea to potentially use RF energy to non-invasively monitor glucose and monitor blood pressure. And so the company started in that vein. And as we started to look at the opportunity, we said, what's really important, even if we're able to measure glucose and blood pressure, is measure everything, get a comprehensive look at one's health. So the typical things like heart rate and your oxygen levels and breathing and activity and sleep, all of these metrics. And so we started to think about developing a platform that could be used to provide a comprehensive solution. As we're still working on developing a glucose, non-invasive, and blood pressure without a cuff solution, and that is a really difficult project to do, but something we're making tremendous progress on and have run a lot of clinical trials, and that's future stuff. We wanted to build a platform first. And as we started to look at all the wearables on the market, and you've reported on and aware of most of them, we found a couple of gaps out there today. Number one, a lot of people are looking for medical grade type solutions, especially in the healthcare industry. There's a real desire to be able to monitor people at home, especially through the course of COVID. Everything was done virtually. In the United States, we pay twice as much for healthcare per capita than other developed countries, and our health isn't so much better. And so, what are some of the ways where we can improve health? And I think one of the major ways of doing it is monitoring people in their home and being able to track them over time. And so that was a very important element for us, the healthcare related aspect. The second was we found that a lot of the products seemed to be kind of bulky, a little thick to wear, often looked like they were designed more for men and maybe not so feminine looking in how they would be perceived. And so we actually interviewed over 1,000 women and found out what they were looking for in a health wearable and what they wanted to get from it, what was important to them. And so we embarked on this program to develop our first product specifically geared toward women and do it in a ring form factor as I'm wearing here. And we really have two focus. On the one hand, we want to have accurate data, medical grade data, but on the other, we want it to be something that's really aesthetically pleasing to the user because we want them to like wearing it. We want them to feel like this is a piece of my jewelry. I love wearing it. I think it looks good. I'm going to wear it all the time because if you don't wear it, you don't benefit from it. So we really focused on the wearability and the usability and the performance and the accuracy. And through all that, we've gotten just tremendous feedback from the community. Uh, Everyone believes that going after health related wearables, something that's truly medical grade in the home, is incredibly important to us. And the second is putting a focus on women for a change. Often men come first, and having a focus on women whose bodies go through many more changes through the course of their lives, through childbearing years and then into menopause than men. And there's a lack of understanding about menopause. 92% of women believe that have stated they're unprepared for menopause. They don't know what to do. They don't know what it is, and they're looking for help and guidance. And so we're trying to develop a solution that will help women through their life's journey initially, and over time we'll expand and have something for men. But we want to do something up front for women to really help them lead a healthier life and give them insights that allow them to learn how their lifestyle can impact their health.
For sure. I think a lot of interesting points that you made through that explanation, and thanks for breaking it down. Even initially, kind of in the background, right? Developing what it sounds like technology, R&D, patents through radio wave technology, and all these things that get into non-invasive tracking. To your point, not quite ready, right, for the main stage for consumer wearables at this point. But certainly there seems to be a growing consensus that it will be at some point, and it's a matter of like understanding what that looks like. But in the interim, building out this platform to get it in the hands of people and potentially start to understand what as they interact with it, what that looks like. And in doing so, a wedge into the market. Not only is it, the ring form factor, which is fairly new in terms of, what that looks like in the consumer space, but also kind of catering to women who, as you stated, have a variety of needs throughout their life and are certainly, whether we see like cycle tracking and apps that then interpret, what's going on, not only day to day, but for performance, for overall health, for physical fitness, all these different insights. So as you're doing the kind of interviews, you said speaking with a number of different potential customers, what was it that kind of led you down this path to say, hey, we want to introduce a product, right? We want to get out there in the market. We know that from the form factor and the continuous tracking that it's going to be a ring. And then why initially, what was that feedback like for the women's health market? And how do you think that kind of differentiates the whole spectrum of wearables where they are now?
One of the things that we found when we spoke to a lot of women, and most of the women we spoke to were from, say, age late 20s, 30, up into the 60s and 70s. Most of them aren't training for a triathlon. They're not working to run a 4 minute mile. They're really living their life. They've got a job, they've got family, they've got other commitments, and they're trying to find a way where they can feel healthier, get better sleep, like the way they look with their body, but do something that fits into their lifestyle. because we're all busy, and they want something that allows them to get the level of activity that they need and want, and get the amount of sleep that they need and want in a way that fits within their lifestyle. And so a lot of companies have focused a lot purely on fitness and activity and monitoring and improving this metric and that metric, and getting it. And a lot of the women that your regular person out there isn't really able to do that or interested in it, because they've got a job and a family and other commitments that they need to deal with throughout the course of the day. And so what we've really worked on is building in the smarts into the device, where we can record all the data, the heart rate, the SpO2, temperature, respiration, sleep stages, activity, calories burned, mood, logging, menstrual cycle tracking, and do the correlations for them. Help them understand how maybe in a certain time of their cycle, it's better not to go for a real hard run, but do more walking or other type of activity. And how certain activities affect their sleep in one way versus another, and how they may be affected during different stages of their menstrual cycle over time, so that they're more aware and they can actually optimize the way they're living their life, or at least have the knowledge and insights about, hey, I shouldn't expect to be able to do this today because I'm at this point in my menstrual cycle, and because of my hormone levels and whatnot, it's not going to work out that way today. So I'm going to have my more activity and more exercise on this day, when I'm going to be better equipped to do it well. And a lot of what we want to do is have those aha moments for people, where they can leverage that information and be able to, I think, feel better about themselves and feel healthier in general. That's really what we're trying to do. And the fact that we're couched in medical grade data opens up a lot of opportunities with other medical device companies, payers, big pharma, and others, where they want to have home tracking of measures and analytes with an FDA cleared device. And our ring, we did file. What we announced recently, we have filed with the FDA, and it's in that review process right now for the heart rate and the SpO2 functionality within the ring today. And we look to expand that with more analytes over time. And yeah, at some point in the future, maybe we'll pop in the glucose and the blood pressure too. We've got 2 or 3 more measures coming in the future before, in the nearer term before that. But we really see a nice pathway of ultimately having a single product that could in the future continue to be a ring or a band that's monitoring multiple analytes, giving you a really comprehensive view of one's health.
Yeah, I think there's again a couple of things in there I want to talk about. Definitely down the path of FDA insurance and really getting into healthcare, but quickly on the point around women's health, I think it's something obviously personally I have not experienced, but my wife, her trying to understand and ultimately having to use multiple different apps and devices to kind of put this information together in a way where she feels responsible for like trying to figure it out. Maybe she's tracking one thing over here, fitness over here, using a wearable for these different measures. Now getting it to the place where it's proactively telling you like, hey, you don't have to think about this, we're thinking about it for you. I think building that platform is certainly something that will resonate and down that path, given that there are other apps, other wearables that do some of these similar things. How are you kind of positioning it? What is the messaging like to make it clear like this is how we're separating ourselves, this is how we're going to market, and ultimately like this is how we're conveying the value proposition to that kind of consumer?
First and foremost, the app and the product itself is very female focused. I mean, it's designed specifically with women in mind. The fact that the ring has an open design and you can see I'm squeezing it and it's got a little give allows the ring to flex over the knuckle, and also give a little bit when your finger may swell at different times of the day, at different times of the month. And often people have rings on their finger and they can't get it off, and it's really tight because your finger swells at a different time. The charger that we developed is like your earbud charger, where it can be charged. And so if you go on a trip, you can just bring this with you. And that's all you need. You don't have to bring a cord and a cable. A woman can put this in a purse, bag, whatever, take it with them, and they're all set to go when you need to recharge the ring every 3 to 4, whatever days. They have that very ease. So ease of use on the wearability, the look of the ring. Wall Street Journal just published a recent article that said we were the most appealing ring that was coming out. And yet, on the other hand, we want to be the most accurate with a medical grade ring. So cover both bases. That was very important to us with the development of this. And then in terms of that app experience, we focused the app specifically with women in mind. And we do want to make it more simple. I was looking at something online recently where a person was collecting data, like you mentioned, from multiple different devices. And they were creating this big XY chart and monitoring things and trying to correlate X to Y. It's hard. And women told us, we don't have the time for that. We don't want to do that. We would love it if you could help us understand what to make of all this data. A lot of the products give charts of data over time, and you see a blip and you're like, okay, is this good? Is it bad? What does it mean? We want to distill it all down to something simple for people, something that's easy for them to understand. And so part of what we're going to do over time and what we're already planning and developing code for, and we have AI algorithms, things are going to be running in the cloud to look at correlations and things that we can feed back to users over time. But we want to look at the data and give them insights and let them know so they don't have to worry about it. We can do it for them. And I think that's one of the big differences of the way that we're thinking about it today than some of the others.
Hey everyone, we'll get back to the show in just a second. But first, I wanted to tell you about our exclusive PR partner, Jack Taylor. Honestly, this one's a no-brainer. We've known the Jack Taylor team for years. They work with some of the most innovative health and wellness companies. We're talking Whoop, Athletic Greens, Hyperice, and many more. Jack Taylor has an extensive industry network, knows how to work with high-growth companies, and really invests in building long-term relationships. I know this firsthand because they're Fitt Insider's PR agency, so I can confidently recommend them, and I do all the time. From startups to more established brands, they go beyond pushing product to help companies truly thrive. To learn more, head to fit.co/Jack Taylor. That's FITT.co/Jack Taylor. Now back to the show. Yeah, I think to that point, there's certainly no shortage of wearable devices in general. From the watch or the band perspective, it's not a new idea. Even the ring starting to become more common, call it in the last 5 years, really 3 years. How did you think about, or did you think about competition in the space? We need to go and have this different design, this different focus on the core audience. And as you start to think about it, I'm asking that question because is it something where, whether it's initially like the watch, like an Apple Watch or a band or even a ring, like the device becomes almost a commodity, then it's all the other features, the healthcare applications, the FDA clearances. Is that what differentiates it? Or how do you think about competition in that space?
It's a great question. Obviously, there's a lot of wearable devices out there today, and I think in general, all the devices, if they've done nothing more than get people to do an extra 300 steps in a day or whatever, they've done a service without question, right? We're trying to take it to the next level. So yes, you're going to see more and more rings and other form factors over time, and that may become a bit more of a commodity, although the design that we've done and how you charge it and other things we think is a differentiator. And there's not that many rings yet, but I think you're going to see more for sure. It's happening already. So that's one. But yeah, to your point, what's really important for us is being a medical device company. That opens up doors for our organization to get into the healthcare space that are closed for other entities because all wellness devices have a little label at the bottom that says not for medical purposes. On them, and we won't have to have that, assuming we gain FDA clearance. And there's no guarantee, obviously, that we'll get clearance, but we feel pretty confident. And I've done a lot of these in my career already, so I know what's needed, and I feel pretty good about where we are. So that does have a real advantage for us because of a few things, and you started to touch on them. One, we could seek reimbursement from a healthcare entity, or certain healthcare entities could offer people lower premiums if they're willing to share their data, or even in certain high risk populations, maybe give them a product like this to use to track because these organizations want to have a better understanding of that person's lifestyle and what's going on with their vital signs, metrics, and a product like ours can provide them to them. So absolutely, when we think about healthcare space, that is a differentiator. The other for the general consumer is what you get from the app. There's really two things involved with wearing these things. The first is the wearability and how much you like wearing it. And is it a nuisance to wear and how often you charge it and how hard it is and all that. That's the one aspect. But the other is, do they feel like this app gives you something of value that you want to keep using it over time? We're tying a lot of the female focused work into their menstrual cycle on a 30-day. And we're going to be doing predictions moving forward once we collect data over several months to be able to inform them about what's going to be happening, what's coming up, and how they can prepare for it in advance. And that's very important to us and critical. So, yeah, that's a big differentiator. When you start to get to the insights, you start to get to the predictions, you start to provide them notifications of when things may be improving and celebrate, or when things are starting to maybe go off the rails a little bit and how to get back on track. And I think that's where we're headed with this.
Yeah, I especially wanted to talk about this healthcare piece, given, you said you spent your career doing this, focused on this space. And oftentimes, you said it right. Like, whether it's, and this happens a lot, from supplements to wearables to it all, not approved by the FDA, not, this is a wellness for, these statements are not regulated, basically. And so then you have this kind of broader statement that I feel like a lot of companies make that say, someday, at some point, we will figure out the way to get into healthcare, or to make this connection, or to partner with insurers, providers, companies. And I think to some extent, there are examples, right, of whether it's a wearable device or an app having a relationship, partnership with an employer who subsidizes the cost of this, or with a healthcare company. But what is it? And I guess this is kind of open ended, because I'm not sure that I fully understand it. And I don't think I've heard anybody really articulate it well. Like, is it the FDA and medical clearance piece that is preventing that leap into healthcare in a way where we can say, hey, you wear this device, you do these preventative, acceptable health things, you show progress, and there is an incentive for you. You will save money, you will get a reward, you will get something more meaningful than, what oftentimes it's like a gift card, or something, a novelty that really doesn't convince somebody to take those steps, because it's not something they want. They don't see how it translates into, their life. So what is missing in that kind of ecosystem to say, like, yes, this is for prevention, you get incentivized and rewarded to be healthier, and like, this is how we close that gap?
Well, first off, as it relates to wearables being used in healthcare today, a lot of self-insured companies can kind of pay for or do whatever they choose to do as an organization. So if they feel like offering a free wearable to every employee will get a certain portion of them to use it and maybe exercise more or do other things that will improve their health, they can make that decision. And they have made that decision. And I think it's probably been a positive decision in many ways to do that. When you go more to the pure healthcare entities, they're looking for solutions that ideally are medical grade, because then that data has the FDA stamp of approval behind it. It's a regulated medical device. And if I'm a big pharmaceutical company and I'm gearing up for a major clinical trial and I have to collect the evidence and the data in a filing to a regulatory body, I'm probably going to need to use a regulated medical device to collect that data to provide it to them. And so that's one of the delineations between the two. Now, 15 years ago, 20 years ago, insurance companies, healthcare payers, et cetera, we mostly as a country, or just in general, we've always waited for people to get sick and then we treat them, and we pay a lot of money to treat them. The progression of a lot of our healthcare problems take 10, 15, 20 years to get to the point where often, boom, then there's an event, and it's an expensive event. It's expensive to the health of the person who's experiencing it, and it's expensive to the healthcare system. And as we've come forward in time, more and more, we're starting to think more proactively about what can we do today that can actually derail that and get it to where it needs to be and not be on this crash course. Because sometimes by the time you understand that you've got this problem, it's almost too late to do much to correct it from that point. But if you addressed it 5 or 10 or 15 years earlier and did little subtle changes, you can actually delay it or maybe make it so it's not going to ever happen. And I think there's much more openness and thoughtfulness today to getting there. Now, how do we incentivize a consumer to do these things appropriately? Sometimes it's done with money. I think today you have a lot more people who are much more aware of their health than ever before. I think COVID was a huge, horrible wake up call for all of us. And the fact that people who started off not so healthy were the ones who were most compromised by COVID, led others to say, I need to be healthier because I want to be able to withstand whatever's coming my way in the future. And so I think we're much more aware of our health than ever before. I think we're much more open to thinking about what we can do more proactively versus I don't care about my health ever, except when I see my doctor, whenever that happens. And then we talk about my health. And now maybe people are starting to say, hey, how can I be a little more healthier day in and day out through my life? And so I think some is coming from changes in behaviors of people. And I think that
Sure.
some is going to come with different modalities and tools that we use to incentivize people to take the right approach and the right behaviors. And I don't have those answers today, but I know a lot of us are trying to think it through. What we're trying to do is make this ring pretty enough where women are like, hey, I'd wear that as jewelry anyway. So I'm going to wear it. And they have an app experience where, oh, this is cool. I'm getting something for it. So the burden of using it is far lower than the value that they get from it. And we want to get to the point where people just want to wear it, miss it if they're not wearing it, feel naked without it. And that's what we're shooting for in all of this.
Yeah, as the kind of focus shifts to well-being and hopefully prevention and forming these healthy habits, it's almost making, whether it's with the device, an app, other, you name it, you name the brand or whatever it is that's helping people live a healthier lifestyle. Hopefully it becomes the default mode, right? And that we figure out how to make that connection between we're doing all of these things. And yes, I think anybody who has been able to maintain or at least strives to maintain healthy habits more often than not, intrinsically, personally, in their daily lives, like you can't deny, right, the benefit. I
Yes,
feel better, I look better, I perform better, I sleep better, what all those things, I
exactly.
live longer. But then for seemingly the vast majority of the population, right, where maybe that hasn't quite clicked or they don't have the access, the information, the knowledge, the whatever it is to fill that gap, that's where we get to this place of, right, all of us trying to solve that problem. And I'm curious if it's, from your perspective, maybe Movano and the Evie Ring aside, is it this digital preventative wearable future that's going to do that in a way where, it again, it becomes the default mode? Or are we, I don't want to say getting distracted, but focusing on the kind of innovation hype, shiny objects too much? How do you think about that and making kind of that future, right? Kind of willing it into existence to solve this problem?
You bring up, I think, a really, really important point there. As a company, we are very thoughtful about how we can reach underserved populations, people who don't have the economic viability. They don't have nearby infrastructure for healthcare available to them. And often those people don't have the best diets in the world, and they're the ones who need some of these solutions the most, but they don't have access. They don't have access to healthcare. They don't have access to the tools. They don't have access to the right infrastructure. So I believe personally that what we need to do is make it seamless. In other words, everything that happened during COVID with the ability to have telehealth communications. Do it from your home, do it from your work. You don't have to take off a half day of work, go get parking, pay for that, pay for a visit, wait for 2 weeks to get some, and if it's even accessible to you, we need to be able to bring healthcare to people and even reduce the transportation burden. Okay. Reduce the burden of them getting in front of someone and then reduce the burden of cost. If we can track all these health metrics day in and day out over time for someone for very little cost in the scheme of what healthcare is costing us for to taking care of these people when they get really sick. It's minuscule in comparison. And we can work out programs with payers and others to be able to implement this as part of the solution. I think that's what's going to do it for us. Bring it to them in a way that they have access to the care, track them so that we understand if they're starting to deteriorate with health. We can get them the interventions when they need it, not when it's too late. And then give them little pearls of insight about how they can make subtle changes in activity, in diet, in sleep, or whatever to be able to really delay the onset of chronic conditions that often occur in those populations. We've got to do a better job of that across the country. We can't just have healthcare for people who can afford it and have access to it. We need to get it for everyone. And I think using these solutions, digital health, bringing devices to the home, wearable, low cost, and better education, very simple through apps and whatnot, is really what's important in my opinion, and something that we strive to do long term with our product. And part of being a medical device, getting that reimbursement, getting that coverage where someone can have this on their finger for free, no cost to them, and be able to benefit from them is ultimately where we would love to be. Because I've always, my career has been in medical device. My passion has been around trying to help people, and this is an opportunity to help a lot of people in a significant way maintain good health. So I know that's a big high flying mission, but we want to play a little role in making that happen.
No, it's exciting to hear, and I think, personally, I'm in that camp of, at the end of the day, everything that we do, whether it's through the podcast or newsletter, putting out content, investing, working with other companies, it's all, hey, how can we help one person be healthier? How can we help one company who helps people get healthier? How can we spread the word about other companies who are helping people get healthy? And you have to kind of maintain that optimism, because what's the alternative? That, oh, we can't solve this, that we're not
Yeah.
going to invest in this, that we're not going to prioritize it. So I think that your message resonates with a lot of people, certainly our listeners and community. As we get towards the end of the conversation and kind of wrapping up, and I wanted to look ahead a little bit. You mentioned, having submitting the FDA to get the clearances, thinking about the product out there in the market. What are you kind of either excited about, looking forward to? What should we be looking forward to? From you, Movano, the Evie Ring, all those things kind of coming up.
Well, our team obviously is very busy right now trying to prepare for a launch this fall. So we're really excited about the work going on there. It's a massive undertaking, setting up all the production and manufacturing and processes to make this happen is a lot of work, but we're really excited about that. Having a female focused product in a ring form factor and this new app experience that we're developing, we're excited about rolling that out and starting to get feedback. The first generation won't have everything probably that people want, but we are listeners. We're learning from everyone who we've already talked to, the over 1,000 women that we've spoken to already. And we're really excited about learning from the people who want to come along with us on the journey to use the product and provide us feedback, because we're going to keep making it better and better. And ironically, the longer you use the product, the more insights we'll be able to generate for you as we learn about your body. And one of the things that's important to us too is customization and personalization of the app experience. So maybe you're a person who likes to be on a stationary bike to get your exercise versus walking. Well, if you're on a stationary bike, you're not going to get any steps in the day, but you're still going to get the activity that you need. And so we want to make sure that we're monitoring and logging activity, whatever form it takes for you, and give you credit for that, and make sure we highlight the benefits of what you're doing as you get that activity. So we've come up with these concepts. We're implementing in our app experience, and we're really excited to see how it's going to play out with the community and what we can do to enhance it and improve it and give the people more and more over time. So through the rest of this year, that's a lot about what we're focused on as an organization. We do have another group. We're very excited about the work that we're doing. We've developed this small little integrated circuit chip that could even fit in a ring that does this radio frequency measurements. And we now have that chip in a little circuit board in a wrist-worn wearable that we're evaluating for clinical studies for blood pressure. And then we'll be doing stuff in the future for glucose as well. And so we're really excited about that work that's going on. Obviously, that's some of the future. And so we've got both of those in parallel. But I would say we're really excited about this new product hitting the market, and quite frankly, how we can partner with the community on making it better and better and serving their needs more and more over time. We think we've got a real engine with how we manage data. By the way, how we secure data in the cloud as a medical device company. We have to file a cybersecurity assessment that's done by a third party to look and see if they can penetrate into our platform. Everyone's very aware about privacy and security of data these days, and we're doing all the work that you would expect from a medical entity to assure, to the best of our ability, that we keep their data safe. And that's important to us, especially when we're dealing with women's health and their menstrual cycle and tracking. So we're really trying to look at this comprehensively and assure that we have a platform that's giving everyone peace of mind and a product that they find value in. So yeah, that's it right now in a nutshell of what we're excited about at the moment.
Yeah, nothing much, not too much going on. Yeah, and wrapping up and getting you out of here. Looking forward to all of those things for folks who want to learn more, kind of stay up to date on when the ring is going to be rolling out and other developments. Where would you kind of direct them to?
Eviering.com, EVIE ring.com. Head there and you can see a lot about what we're doing. By the way, we've been presenting a lot of blog posts and other articles online, giving people insights about just general about health for women, about the importance of sleep and some factors that affect sleep, for example, and other things like that related to your health and lifestyle. So not just what's in the ring, but also providing information in various ways to consumers that they may find valuable in living their life.
Perfect. We'll have links to everything below in the show notes. And John, we appreciate you stopping by today to kind of give us all the updates and insights. Really enjoyed the conversation.
Thank you. I've enjoyed it as well. It's been my pleasure. Goodbye now.
One more thing before you head out, help us spread the word. Take a minute to rate and review the podcast, subscribe to the YouTube channel, or share this episode with a friend. And if you like conversations like this, you'll love the Fit Insider newsletter. We send it every Tuesday. The link is in the description. Thanks again for listening. We'll see you back here next week.